Welcome to Med-Surg Tutor. In this video, we'll be going over vital signs. We'll look at some things like normal ranges, some nursing considerations, and interpretations of vital signs. Before we begin, we need to know the important vital signs and what information they give us. Temperature measures the body's internal heat level. Pulse measures how fast the heart is beating, which is important for assessing heart health and circulation. Then we have respiratory rate. This is the number of breaths a person takes in 1 minute. Next is blood pressure, which measures the force of blood against the artery walls as the heart pumps. And last but not least, oxygen saturation. This measures how much oxygen is in your blood. Familiarize yourself with these abbreviations I put on the side, because in a clinical setting, you might see these vital signs given by these abbreviations. All right, here's a quick reference to the normal ranges for all 5 vital signs. Keep in mind, though, that these ranges are just general guidelines, but they can vary a little bit depending on the textbook you're referring to. For example, some textbooks might show a slightly higher or lower normal temperature range. Just remember to double check, but these are typically the ranges you'll see in most clinical settings. You might want to memorize these, because vital signs are vital. Now let's break down how to measure the 5 vital signs. First, we have temperature. Here you're going to want to grab a digital thermometer. There are different ways to measure temperature actually. You can measure it by mouth or orally, under the arm or axillary, or even rectally. A little fun fact. Taking the temperature the rectal route actually gives you the most accurate result. You may also ask, why are there so many ways to take temperature? Well, say for instance your patient just had a cold drink of water. That can affect the correct temperature, which gives us false data. A little bit of critical thinking. Now for pulse, just gently press on the wrist or neck, feeling for the arteries. Count the beats for 30 seconds and then multiply it by 2. For respiratory rate, watch the chest rise and fall, count the breaths for 30 seconds, then multiply by 2 again. Here I've actually provided some images of a nurse taking vital signs. Next we have blood pressure. You'll need a cuff and a stethoscope. Wrap the cuff around the arm, pump it up, and listen for the beats. Here on the right hand side, there's an image of a nurse taking the blood pressure. The first one you hear through the stethoscope, the top number is going to be the systolic, and when it stops, that bottom number is going to be a diastolic. A lot of nurses like doing the blood pressure and the respiratory rate at the same time, because if you let the patient know you're counting their respiratory rate, they might start breathing differently, which will give you false data. Last up is oxygen saturation, which you can check with the pulse oximeter. On the left, I provided a picture of a nurse actually putting it on a patient's finger. It'll show you the oxygen levels in the blood between 95% and 100%. Easy, right? Practicing these skills on your friends and family can familiarize yourself with the skills of obtaining vital signs. Another critical thinking skill here. Let's say your patient has nail polish on their finger and you're trying to take their oxygen saturation. Well, you would have to remove that nail polish because, again, that nail polish can actually give you false data. So a lot of things can affect vital signs. Age plays a role. Older adults might have a slightly lower body temperature and higher blood pressure. Physical activity can boost your pulse and breathing rate. So if a patient's been moving around, their numbers could be higher than usual. And athletes or people who work out usually have a lower resting heart rate. Medications are another factor. Things like beta blockers can slow down the heart rate, while stimulants can make it increase. Pain is a big one too. It can make the heart rate, breathing rate, and blood pressure all go up and be elevated. And of course, Emotional state. Stress or anxiety can really spike the heart rate and blood pressure. So it's important to think about these when you're taking vital signs. This is where you apply your critical thinking skills. So if you're looking at your patient's vitals and you see that they're out of range, maybe some of these factors can be the reason why. On this slide, you'll see some important terms and definitions. Understanding these helps you know what's normal and what's not when checking vital signs. For example, tachycardia means fast heart rate, which is over 100 beats per minute. It could be caused by things like stress, fever, or even dehydration. So if you see a heart rate of 110 beats per minute, it's outside the normal range, and you'll want to assess the patient further and look for any other signs to figure out what's going on. Maybe they just came back for a brisk run. Using your assessment skills is going to be very important here. And knowing these definitions is going to be even more important. Think about this. If your patient has a fever, it may indicate that they're fighting an infection. That's why it's important to know these terms. You can combine them with your critical thinking skills to know what's going on with your patient. Now we're going to go over abnormal findings and some nursing interventions. First, you're going to want to identify the cause once you've gathered all the data from getting the vital signs. This is the most important step. Assess, assess, assess. You need to figure out what's causing the abnormal vital signs. It could be something like pain, an infection, dehydration. The more you know about what's happening in the patient, the better you can help, which leads into no appropriate interventions. Once you've identified the problem, you need to be ready to take action. For example, if oxygen levels are low, you need to administer oxygen. If blood pressure is low, you can elevate the legs to help. For fever, antipyretics like Tylenol can help bring it down. Whatever the situation is, knowing the right intervention is key. Next, you're going to want to monitor closely. After you've taken action, keep a close eye on the patient. Track any changes in their condition. Vital signs can change quickly, so make sure you're checking in regularly to see if the interventions are working or if something else needs to be done. Finally, you're going to want to notify the healthcare provider. If the patient's condition doesn't improve or you're unsure about the cause, you should escalate the situation. Always notify the healthcare provider because it's better to let them know sooner rather than later, especially if the patient is getting worse. And I didn't write this one on here, but always document all of the interventions you've, carried out. All right. On this last slide, I included some things that may be helpful to know when studying and going over vital signs. Baseline. Always know the patient's baseline vital signs, as normal ranges can vary between patients. Any changes from their baseline can tell you there's a problem going on. The patients who have baseline vitals out of range could be older patients, patients with chronic diseases, things like that. Critical patients. For critical patients, even the small changes in vital signs matter. Keep a close eye and watch the patient, especially if things aren't improving. Sometimes you may be instructed to take vitals as often as every 15 minutes with these types of patients. Children and infants have different normal ranges for vital signs compared to adults. So be sure you're familiar with the age-specific norms, because depending on whether your patient is an adult or a child, you'll be looking at a different set of numbers. Finally, critical thinking. Use your critical thinking skills to assess and interpret vital signs. Don't just follow the numbers. Look at the whole picture and trust your instincts when something feels off. Remember, the patient's safety and health is the priority. Now you've got the basics on vital signs, what to look for, and how to act when things are out of the ordinary. Remember, assessing vital signs isn't just about reading the numbers. It's about understanding the whole picture and knowing when to step in, especially your role as a nurse, what to do. Thanks for watching, and don't forget to keep practicing your assessment skills. Stay sharp and always trust your clinical judgment.